Hey everyone, it's Dr. Mike here, and you know I'm all about empowering you to take control of your health. Now, I'm not talking about every little sniffle, but there are certain signs and symptoms that should never be ignored. We're diving deep into 10 signs that should have you picking up the phone and scheduling that appointment as soon as possible. Let's get started. All right, let's talk fever. Our bodies are pretty amazing, and fever is actually a sign that your immune system is working hard, fighting off some kind of infection. But there's a difference between a passing fever and one that just won't quit. If you're running a temperature over 100.4 degrees Fahrenheit, 38 degrees Celsius, for more than a few days, or if it keeps spiking above 103 degrees Fahrenheit, 39.4 degrees Celsius, that's a sign you need to see a doctor. Persistent fever can be a signal of something more serious going on, like a bacterial infection, a hidden virus, or even an inflammatory condition. If that fever comes with a stiff neck, a severe headache, confusion, difficulty breathing, or a rash, head straight to the emergency room. Sudden, unexplained weight loss, and I'm talking a significant drop without even trying, is something you never want to ignore. If you're losing more than 5% of your body weight over a period of 6 to 12 months without any major changes to your diet or exercise routine, it's definitely time to see your doctor. This kind of unexplained weight loss can be a sign of a whole range of underlying medical conditions, from hormonal imbalances to digestive issues to even certain types of cancer. Early detection is key, and your doctor can help figure out what's going on and get you the right treatment if needed. Pain is your body's way of telling you something's wrong. But sometimes that signal gets really loud, and that's when you know it's time to seek medical attention. We're talking about pain that's severe, persistent, or just doesn't seem to have a clear explanation. If you're experiencing pain that's interfering with your daily life, preventing you from doing the things you love, or just doesn't go away with over-the-counter pain relievers, it's time to pick up the phone and call your doctor. The causes of severe or persistent pain can vary widely. The important thing is to get a proper diagnosis so you can get the right treatment. Your doctor can help you find relief and get back to living your life to the fullest. Shortness of breath, that feeling of not being able to get enough air, like you're constantly gasping for breath, is a serious symptom that should never be ignored. If you find yourself suddenly struggling to breathe, especially if it comes on with chest pain, confusion, or bluish lips or fingernails, call 911 immediately. That could be a sign of a life-threatening condition like a heart attack, a pulmonary embolism, or a severe asthma attack. Even if your shortness of breath is less severe but persistent, or if it's getting worse over time, it's still crucial to see your doctor. Shortness of breath can be a symptom of a variety of conditions, including heart problems, lung diseases, anemia, or even anxiety disorders. Breathing is essential, so anytime you're having trouble with it, don't hesitate to seek medical help. Let's be real for a minute. Nobody loves talking about bathroom habits, but trust me, these are conversations you need to be having with your doctor. Our bowel movements and urination patterns can actually tell us a lot about what's going on inside our bodies. If you notice any significant or persistent changes in your bowel or bladder habits, it's important to bring it up with your doctor. We're talking about things like persistent diarrhea or constipation, blood in your stool or urine, frequent urination, especially at night, pain when urinating, a feeling of incomplete bladder emptying. These changes could be a sign of a wide range of conditions, some of which can be serious if left untreated. For example, persistent diarrhea or constipation could indicate a digestive disorder like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, or even colon cancer. The point is, don't be embarrassed to talk to your doctor about these things. Our brains are incredible, but they're also complex and delicate, so anytime you notice sudden or significant changes in your mental state, it's crucial to take it seriously and seek medical attention right away. We're talking about things like confusion, disorientation, difficulty thinking clearly, memory problems, changes in personality or behavior. These changes can be a sign of a wide range of conditions, some of which can be life-threatening if not addressed promptly. For example, sudden confusion or disorientation could be a sign of a stroke, a brain infection, a head injury, or even a severe electrolyte imbalance. Early diagnosis and treatment can make a world of difference. All right, let's talk about another potentially awkward but incredibly important topic: unusual bleeding or discharge. Our bodies are constantly giving us clues about our health, and anytime something seems off with our normal bodily fluids, it's a sign to pay attention. Unusual bleeding could include bleeding between periods, heavy or prolonged menstrual bleeding, vaginal bleeding after menopause, blood in your vomit, urine or stool, unexplained bruising or bleeding from your gums. Unusual discharge could involve a change in the color, consistency or odor of vaginal discharge, nipple discharge, discharge from a wound that's foul-smelling or discolored. These changes can be caused by a variety of factors, some more serious than others. For example, unusual vaginal bleeding can be a sign of hormonal imbalances, fibroids, endometriosis, or even cervical cancer. Blood in your vomit, urine, or stool is always a red flag and could indicate a serious condition like an ulcer, kidney stones, or cancer. Nipple discharge can be a sign of a hormonal imbalance, an infection, or even breast cancer. And any discharge from a wound that's foul-smelling or discolored could indicate an infection that needs prompt medical attention. The bottom line is, don't ignore these signs. Talk to your doctor and get the answers you need to take control of your health. They've heard it all before, and they're there to help you. We all get coughs from time to time, right? It's usually just our body's way of clearing our airways, but when that cough hangs around for weeks on end, or if it's accompanied by other symptoms, it's time to get it checked out. A persistent cough, one that lasts for more than 2 weeks, could be a sign of something more serious than a common cold. It could be caused by allergies, asthma, GERD, bronchitis, pneumonia, and in some cases even lung cancer. Hoarseness that lasts for more than 2 weeks could also be a sign of something more concerning, like acid reflux, vocal cord nodules or polyps, thyroid problems, and in rare cases even throat cancer. So if you're dealing with a cough that just won't quit, or hoarseness that's hanging around, don't ignore it. Your skin is your largest organ and it's constantly changing. But it's important to be aware of any unusual or concerning changes, as they could be a sign of an underlying health condition. Keep an eye out for new moles or changes in existing moles, like asymmetry, irregular borders, changes in color, diameter greater than 6 millimeters, or evolution. Also, watch for sores that don't heal, rashes that are widespread, itchy or painful, changes in skin texture like thickening, roughness or dimpling, and yellowing of the skin or eyes known as jaundice. These changes could be a sign of a variety of conditions ranging from harmless to serious. The good news is that most skin conditions are treatable, especially when caught early. So, if you notice any unusual changes in your skin, don't hesitate to see a dermatologist or your primary care physician. We all feel tired from time to time, especially in our busy modern lives. But if you're experiencing fatigue that's severe, persistent, and doesn't improve even after getting adequate rest, it's important to see your doctor. This kind of unrelenting fatigue can be a sign of an underlying medical condition such as anemia, thyroid disorders, heart problems, diabetes, autoimmune disorders, sleep disorders, depression or anxiety, and vitamin deficiencies. Your doctor can perform a physical exam, order blood tests, and ask you about your medical history and lifestyle to help determine the cause of your fatigue. Once any underlying medical conditions have been addressed, there are lifestyle changes you can make to help improve your energy levels. Talk to your doctor and get the help you need to regain your energy and live your life to the fullest. Remember, your health is your wealth. If you're experiencing any of these signs, don't hesitate to visit your doctor. We talked about a lot today, and it might seem overwhelming, but the main takeaway is simple: you know your body best. So if something feels off, don't brush it off. Early detection is key when it comes to protecting your health. Stay healthy, stay informed, and I'll see you in the next video. Take care.